Thanks, Dr. Timothy Lowe, for joining us here on Winning Ways. It's a pleasure and it's a wonderful complex that we are sitting here.
Thank you very much.
So, Farrer Park Hospital is the newest hospital complex in Singapore. And it's very unique in the sense that it's a completely integrated complex with a hospital, hotel, and a commercial center. What was the inspiration behind setting up a complex like this?
Well, the inspiration came from a group of professional doctors. They are actually specialists in the different specialties. They have been in the private practice for the past 20 to 30 years. They found that there were gaps in patient service, gaps in patient comfort. So they put the money together. They got a couple of private investors, conceived, designed, and developed this integrated complex, which is a 5-star hotel, the hospital, and the specialist medical center. And this is to provide patients with the service that is needed and that is so lacking in the private practice.
So, Dr. Lowe, what is unique in the Farrer Park Hospital in terms of patient care? I mean, what are the new benchmarks or standards that you're looking to set?
Well, in Farrer Park Hospital, we have reimagined private healthcare to match what is needed over the next 20 years in terms of healthcare innovation and technology. In terms of an integrated complex whereby information can flow seamlessly between the hospital, the medical specialist center, and even families staying in the 5-star hotel. This infrastructure has been put in place to flow seamlessly and for doctors to be able to communicate with each other. The patient first and service first philosophy can be seen in the service provision, in the infrastructure. Just to give you an example, our parking lots are actually 1.5 times the normal parking lots, and this is to give patients who are on crutches the ability to come out very comfortably from their cars and onto their crutches, going to see their doctors or going to the hospital. For doctors, they can have the mobile equipment with them, whether their mobile phones or mobile tablets, wherever they are, whether they're in their clinic or they're at home or they are even attending a conference somewhere outside Singapore. They have real-time information flowing onto their tablets in terms of their patient results, patients' x-rays, CT scans, so they can make real-time decisions on their patient treatment, patient care.
Can you also tell us a little about the wellness initiative here? Because I believe the complex has about 15 gardens, as you were mentioning earlier. So can you elaborate a little bit? I mean, what's the idea behind the whole wellness aspect in the hospital?
Yes, we are also pretty unique in the sense that we take biophilic into consideration when we build this place. What do I mean by biophilic? Bio is nature, philic is the love. So the love of nature, because this biophilic construction is actually a healing element for patients as well as their stressed out family members. We have 15 gardens within the complex, and these are in different themes. We have Japanese garden, which is here. We are sitting in a Japanese garden. We have a garden with a Chinese theme. So these gardens actually give the family members an opportunity to have an al fresco experience, or even patients who are sitting in the ward for too long, they may want to go into the gardens to have a breath of fresh air. We also have actually an urban organic farm within the complex itself. It's 11,000 square feet where we have vegetables, spices, fruits, and these are actually used by the hotel kitchen What's unique also is our patients do not eat hospital food. They get to eat food cooked by five-star hotel chef. They get to order their own food from a tablet which is on their bedside. They have 200 over choices to choose from, and this is something unique. We have over 700 pieces of original art within the complex itself. And you may ask, why art? Because art provides a healing environment for both patients as well as their family members.
Singapore is positioned as a destination for premium medical tourists.
Yes.
So, being the newest hospital in Singapore, how do you see yourself competing or adding to the facilities already available in Singapore? Also, around the region, there are hospitals coming up, whether in Thailand, Philippines, which are also trying to cater to this segment of medical tourists. So how do you see this whole environment, and where do you see Farrer Park Hospital in that?
Yes, with medical tourism in mind, that's the reason why the Farrer Park company has built a hotel, a hospital and a medical center integrated in a fashion that nowhere else has been able to put in place at this point in time. It is so much integrated that the information system is a one full system between hotel, hospital and the medical center, medical specialist clinic. And this aids seamless information flow. The five-star hotel provides a place where foreign patients coming with their families, the patient gets admitted to the hospital, the families have a place to stay, and they're actually just 1 minute away from the hospital, and they do not have to walk outside the complex. Everything is within the complex itself. In terms of competing with other hospitals and other countries for medical tourism, we provide the advanced medical surgical techniques that is needed. Farrer Park Hospital has also top-of-the-line cutting-edge equipment. Being a new hospital, we have to buy the latest. Just to give you an example, for radiation oncology treatment, we are using the Electa Versa HD, the high definition. This treatment will provide cancer patients who need radiotherapy with very precise and very fast treatment. So, to put it into a nutshell, we compete on equipment and technology. We compete on comfort that patient will have and their families will have. We also compete on fair pricing. So good doctors providing fair price for a good value.
Hospital thrives when there is optimum level of patient care. That also means that your employees need to be highly motivated. So what do you really do to keep the motivation level of the healthcare providers, service providers within the hospital at the optimum level?
Yes, employees working in Farrer Park Hospital is our greatest asset. You can have the best infrastructure, the best equipment, but without a motivated team of staff providing the necessary care to the patient, that is a big challenge for any hospital. So at Farrer Park, we have a philosophy of providing comfort, fairness and value. And this is being inculcated into employees' behavior in terms of how they treat each other, how they treat the patients and how they treat the doctors. We have a campaign called POKE, P-O-K-E. So I go around telling them, start poking each other, start poking your customers. And they look at me, what do you mean by poke? So I said, poke means you have to be professional, the P. You have to be objective, the O. You have to be kind, using kind words. And you have to empathize. Put yourself into your customer's shoes. So whenever I go around telling them, have you been poking? They realize, yes, professionalism, objectivity, being kind, and to have empathy. Well, besides this campaign and behavior, we also have many campaigns, many other campaigns like Greet, Smile, and Thank, the GST way of life, the Farrer Park mindset, the Farrer Park behavior. So I will have actually motivating messages going out to them every Monday. I walk the grounds every day so that I can keep close contact with staff, get their feedback. Also to coach them should I find that there is any lacking in service. And I also have very, very regular coffee and tea with my staff, and that's when they can let their hair down, talk to me at a more relaxed atmosphere and timing, to give me feedback, to tell me their thoughts, to tell me what are the innovation and creative things that we need to put in place to make this place a better place for staff, for customers, and for our doctors.
This hospital, I mean, it opened officially, I think, only this March 2016.
That's right.
It's been a very short time. But what's there on your radar now? I mean, what are the future plans, or I mean, either within this complex or outside, in terms of expansion, in terms of growing services or things like that?
Yes, we've just opened. Our official opening was on 16th of March 2016. That's also the day in 1911 where the first plane took off from Farrer Park, this exact location. So we chose actually a very historical date to have the official opening for the hospital. And with that, because we are putting in place the first model of this nature in Asia Pacific itself, we will optimize this place first and foremost, and then we will look at how we can expand into the region. The other aspect to immediately reach out is by using telemedicine. Telemedicine is also part of the future of medicine. Telemedicine, teleconsult, that's something that we can reach from hospital to patients at home, or from hospital to doctors and patients in other countries. Our infrastructure is in place. We are ready to roll that out.
The last question is, in terms of the healthcare sector, healthcare providers, what do you think are the winning ways for healthcare providers? Because it's not just about business, it's also a kind of a social business. I mean, in the sense that you are interacting with patients, people seeking assistance to improve their health or get over a certain condition. So, according to you, what are the key winning ways for success in this particular sector?
The key winning ways, I would say, is to disrupt the healthcare norm. Like Uber is disrupting transportation, Airbnb is disrupting accommodation. We are here to disrupt the healthcare, to disrupt the healthcare norm. And how do we disrupt? By being creative, by being innovative in service, and also in pricing. So, just to give you for example, if our bed occupancy in our 4-bedder is low, we will have a dynamic pricing. It's just like hotels have dynamic pricing during events and during non-event. The hospital, traditional hospital, has always got fixed pricing. We will disrupt pricing. We will do dynamic pricing. So that's one of the ways to be ahead and to disrupt the healthcare norm. And that's one of the winning ways.
Thank you very much, Doctor.
Thank you.
Thanks for